Angela Farmer. I'm the Executive Director here at Behavioral Health Services of Pickens County, and I have been employed here for 25 years this year. Actually started doing stuff with behavioral health when I was 14 years old. Started on the youth board as a kid and did that for 4 years of high school and 4 years of college. And then after I graduated with my undergrad degree, I started working here in our intensive outpatient program. Did that for several years and moved positions from school and child and adolescent services to supervisor of our community-based treatment program, clinical supervisor, deputy director, and now I'm the executive director. So I've grown up here and love this place, and it's just been a part of who I am for a really long time.
I'm Vitale, and I'm the Director of Outpatient Services at Behavioral Health in Pickens County. We provide a variety of services throughout the community, including group and individual therapies. That can include, but definitely not limited to, our substance use for adolescents and adults. It also includes couples therapy, family therapy. We have batterers intervention programs for both men and women, women's empowerment, trauma recovery, along with dialectical behavioral therapy for teens and adults, including in our child and adolescent department. We aim to have a counselor in every school in Pickens County. And then our ASAP program is a program designed for people who have struggled maybe with substance use, but also gotten DUIs and are trying to regain their license. A biggest thing that we find in the community is people think we are just the substance use treatment facility. We are not. Like I said, we range in services from childhood into adolescence through adulthood. We serve everybody. We serve our neighbors, the mothers and the fathers, the sons and the daughters, the teachers, the medical professionals, the mom taking her kid to soccer practice, those who have lost loved ones, kids caught in between parents and custody battles. It's a wide variety of people that we serve. Other things that we do as far as behavioral health out in the community, we start in the buildings with our treatment services and our intervention programs, but then we filter out into the community, not only with our prevention services, but also with treatment. With our child and adolescent department aiming to be in every school in Pickens County, we see kids struggling with behavioral issues and family issues, and being able to be a part of that community allows us to go into the schools and kind of meet the children on their level in their own environment. Teaching them proper social skills in the schools, which aids them in the classroom, which aids their teachers, which improves test scores, which helps them to then take those word lessons back home and share it with their family. And usually our adolescent and child and adolescent therapy is part of our whole community outreach and how we bring them into the family sessions. We always aim to have family sessions with our children and our adolescents. So then it's all about, after that, breaking the cycle from the children to the parents to the grandparents. I've worked with multiple generations of the same family, and when you can start with the kids and break that, then it doesn't continue that cycle.
Hi, I'm Cecily Mccleskey. I'm a clinical counselor at Behavioral Health Services in Pickens, and I am also a student receiving my master's in social work while I am employed at the center. I am currently working also on my addiction and drug certification, and so those are the things that allow me to show up for clients in our community. I am really excited because I've been working to do assessments, so a lot of folks get to see me in their early time at BHS. And they may be returning or they may be brand new, but I have an opportunity to kind of set the stage for what they might be expecting of the experience. Here in the future, I'm going to be leading a Thrive group during the day. It's a really wonderful group that allows folks to come together to talk about their recovery and also how they might reintegrate into the community after we give them the support that we can offer. We're always available for clients even after they finish with us, but I want folks to have a strong foundation to step out into the community after they've gone through their services with us, and making sure that they leave knowing when they can come back, how they can come back, and what resources we're always available to give. but I hope that folks are able to leave the center and the agency of behavioral health services knowing a little bit about who they are and learning a little bit about who they are and learning about what they need from people and what they have to give.
Hey, my name's Hunter Edwards. I am in the admin department here at Behavioral Health. My position is an administrative specialist. Working with admin, you get to work one-on-one with counselors and their clients and seeing them grow from the beginning to the end and the changes in the support system they have here at Behavioral Health. And it's just a wonderful thing to be able to witness.
Hello, my name is Susanna Deming. I have worked here for almost 15 years. I'm currently the Director of Operations here at Behavioral Health and love working here, love the people that I work with, and just glad to share a little bit with you guys today. As the Director of Operations here at Behavioral Health, I currently help to manage the day-to-day programmatic functionings of the agency. I supervise our clinical supervisors and our programmatic directors as well as our administrative directors, and just help to problem solve issues that come up on a day-to-day basis.
Hey, I'm Jamie Chapman. I am the clinical case coordinator here at Behavioral Health. And kind of what I do is, the biggest thing that I do is I help connect clients to resources in the area when they have barriers in their life. I think there's so many people that we have just walking off the streets, just coming, like people who are homeless or people that are been in domestic violence situations, or they just don't know where to go or what to do, and they've just heard about us. And they just walk in and they're like, this is what's going on with me. Can you do absolutely anything? And so it's, the word's getting out there that we're a safe space for people who are just struggling. There's a lot of people in this area who are homeless and have schizophrenia. And sometimes they just stop in and say hello, and our staff is really nice to them. And sometimes they just like to have someone to come up and say, be nice to them, because they're not used to that. And so we have a lot of people that just come in just because they feel safe here. And I think that's the biggest thing, is they have nowhere else to go, and they know that we can at least provide them with direction.
Hello, my name is Timothy Luper. I am a CP, a Certified Peer Support Specialist here at Pickens Behavioral Health. And my job is to instill hope in the community as a living example that recovery works. I live here in Pickens. I raised my family in Pickens. It's my community. And once you look around and listen and observe more, you'll realize that there are people that need help. They're all around you, and they could live blocks away from you. They could be in the house beside you. Whether we acknowledge problems and issues that are out there or not, whether we acknowledge them or not, does not mean they're not there. So my goal and focus is to shed light on those things, that they are in fact there, and we actually have to advocate and do something to make things better for the future generations of my community.
My name is Jessica Gibson, and I am the Director of Prevention Services here at Behavioral Health Services of Pickens County. Part of my job is that I get to supervise the prevention department, and we do lots of different things in the community. A lot of our events and things that we plan are community-based events. And so we have a lot of fun getting to plan these events for the community and providing the community with a safe and drug-free place to come and have a good time. We have three main goals in the prevention department. The first one is to increase the number of people who abstain from alcohol or tobacco or other drugs. And then the second one is to delay the start of use. And the third one is to decrease the number of people who are high-risk users of those substances. And the way that we do that is through community events. The big goal that we have for these community events is to show people that people who are potentially using or who may use in the future, they are just like us. The definition that the community has placed on them of a substance user or a substance abuser or a meth head or whatever it may be. They're more than that. And prevention's big goal over the past year or so has been to fight that stigma, and through various ways, and let people know that there are more than, behavioral health is more than, people in recovery are more than their past. They are living full, healthy lives in recovery. They are contributing to society. They are getting jobs and doing these things totally against what society and people in the community may have thought about them.
Hey, my name is Bria Nicholson, and I am a youth board mentor as well as a prevention specialist here at Behavioral Health Services in Pickens County. The youth board is an incredible group of kids. The youth board was actually created 30 plus years ago here at Behavioral Health Services, and over the past 30 years it's transformed a lot. The group was created to be a peer education group that shares about substance use prevention as well as alcohol prevention and mental health. The kids are a great asset to the community. They're able to go out into the community and outreach to teens specifically about the dangers and risk of substance abuse and alcohol, and most recently, especially in our county, vaping. So they're able to do these different outreach programs where they go out in schools and teach their peers specific education about substance use prevention. And they're also able to host a podcast that we're really excited about. It's called the But They Don't podcast. The kids do everything from writing the script to recording the episodes, editing, the social media outreach for that. They do everything, and it's a really awesome way for them to be able to use their platform. We know that social media is the best way to reach out to teens, and the kids have it figured out for sure. So this podcast is released every Friday, and they cover a lot of different topics. They discuss specific types of drugs. They talk about vaping, alcohol abuse, and mental health. Through that podcast, we've been able to reach out to a lot of different teenagers across all the local high schools and share some really important information that they may not have heard otherwise. One really cool thing about the podcast is a series that the kids created called Community Conversations. And this is an awesome way for the kids to be able to have really important conversations with local leaders. They've had the Pickens City Police Chief on, they've had the Pickens Mayor on, resource officers, representatives from NAMI, all kinds of different places, and they're able to bring them in, have important conversations, and share the knowledge and experience that those people have with their peers.
Hello, my name is Tricia Griffin, and I'm the supervisor for the child care services that we offer here at Behavioral Health Services. I've been here for about 23 years, and I feel like that the services that we offer are a great asset for our clients and for our community. We serve clients in several areas. We have our IOP program here that we are responsible for keeping children so that the clients can attend their sessions on a regular basis. Also, we service the clients that might come into our medical facility or for a counseling session, for an assessment, for a drug screen, for whatever. We're very versatile in that we're there for whatever the client needs. We want our clients to be able to succeed and move forward in living a healthy, happy life and be more than being defined by the substances that they use.
Hi, my name is Pamela Codes, and I am a certified addictions counselor, and I work in the medical building, medicated assisted treatment. I believe the clients that come into our office are all just human beings, and they should never be defined by stigma, by addiction, or anything that makes them feel less than. We provide medicated assisted treatment to help people get off opioids, heroin, pain pills, also alcohol. A lot of people don't know that we help with alcohol abuse as well. So the Vitale shot is a once monthly injection, and it stabilizes people so that they can move on, from any illicit substances that are stopping them from living their lives completely.
So, Behavioral Health Services is turning 50 years old next year, and I think that even being right here and very present on Main Street, a lot of people still don't understand what Behavioral Health Services does. And knowing that we are more than just the place where all the junkies go. So I feel like with us turning 50 and having this revamp of an updated logo and getting this video out there to the community, that we really can start to have a bigger impact on the community and these ideals that the community has about the people that we see here at our office. I think it's important for them to understand that Behavioral Health Services not only treats people and tries to get people back in society and contributing to society who have substance use disorders, but we also see a lot of people who may have experienced trauma or may have experienced domestic violence. There are so many different things that Behavioral Health Services does that we can contribute to the community as a whole and make this community better.
Share with our community that I do believe that behavioral health is more than just a substance use treatment facility. We have been in this community for many, many years, and we want to offer a safe place for people to come. Any individual who's struggling with any kind of a behavioral or mental health difficulty, we want to be a group of people where people can come in, they can feel that they are not judged, that they are able to share openly, and that we can provide support and compassionate care to help people reach their full potential, because so often the individuals who do come through our doors are wonderful people who have a substance use disorder that has, taken a hold of their lives. And they are more than just that substance use disorder. They are parents, they are children, they are creative, they are talented individuals who just need some assistance and encouragement, and we want to be that for them. We work with a great group of individuals and counselors who work very hard to provide good treatment services. We have a wonderful prevention department that works really hard to provide intervention and prevention services to the youth of our community. They do wonderful creative things that I'm sure they're going to share about with you in this video this evening. And I just want you guys to know that we are more than just substance use treatment, and hopefully you guys will come by and visit us sometime.
Being part of this organization for such a long time, I found it interesting that a lot of people in our community don't know who we are and what we do. They only assume that we do substance abuse treatment. And for as long as I've been here, we've always done more than that. We've served children, we've served families, we've worked with individuals with depression, anxiety, lots of trauma issues, women who've been through abusive relationships. We now have a domestic violence batterer program. Just lots of different services to help our community be healthier and develop recovery in their life of whatever their issue is. But most people only see us as substance abuse, and so as an organization we wanted to spend some time and really focus on who we are and what we do offer. But not only that, but for people in our community to understand that people with substance use issues are more than what they're seeing them do with their behaviors. These are people who are hurting. They're people who've maybe not grown up in the best circumstances, and they've learned that substance abuse is the way that they've coped with their issues. But they're people. They're human beings that are hurting. They're human beings who are suffering, and I can promise you I have never met anyone who is a substance use individual who has enjoyed that lifestyle, that they want that for their life. They want a better life, they want a healthier life, they just don't know how to go about it. So if you look past what you see as their behaviors, you'll see who they are as people, and they're some of the most amazing people you'll ever meet. But you got to give them the opportunity to get past that.
We are more than.
Behavioral Health Services is more than.
Behavioral Health Services is more than.
Behavioral Health Services is more than.
We are more than.
We are more than.
And we are more than.
We are more than.
We are more than.
Behavioral health is more than.
We are more than.